All right, guys, so we're going to do
what?
I
didn't have the screen.
numbers 13 through 17 right now, okay? First things first, everybody look at my thumb, which is right here. All right? My thumb right now, you see the way I'm sitting? Volar surface out. We're going to learn these motions, which I think Bill showed you, but let's practice them again. This is flexion at the CMC joint. That's flexion coming across. That's extension at the CMC joint. All right, so again, the joint's up here, right? Flexion, it's what's happening over here, and extension. If my hand is like this, close attention, bringing my thumb away is abduction, bringing it back towards is adduction. So, CMC joint, flexion, extension, adduction, abduction. Everybody on the same page? You must practice those. I guarantee you all four of those will be on your practical. Okay? Because it's a common area for mistake. That's what we're going to be going through now. All right? So, if we're looking for thumb, CMC, flexion and extension. What we're looking... You like that? I figured you'd enjoy it. I figured what you're going to be looking for is that right there. So it's really what's happening right here. All right? Can everybody see that? Don't worry about what's actually happening on the distal aspect. It's really what's happening at the CMC joint. So it's much smaller than it appears. Then extension. Okay? So, this is the one area everybody is bad at math. I'm sorry, you're going to have to think. All right? It's basically from where it rests, all right, to where it ends. So I am starting at about 30 degrees. I am bringing the hand across, and I am finishing at about 10 degrees. So 30 to 10 is what? 20. All right? Now extension does not come from that moment. Extension again comes from your rest moment and out. So this is my rest position. I come out to there. All right? So this time it's going to be a bit from a smaller number to a large number. That's my rest. And I'm coming out. So I am going to about 45. All right? And I started at about, I'm lying to you guys, started at about 30. All right? So it's 15 degrees. All right? So it's going from 30 to 45. And does that make sense to everybody? So for this particular one, you are literally doing, sure. He hasn't done that. Yeah, well, guys, the stationary arm, it's not going to make a difference with your measurement at all.
It gives you more of a concrete
all right?
base to line
If your measurement's going to be exactly the same one way or the other, all right? It's just the way that Bill has it lined up in the book. You're still going to go to 10. You're still going to go to 45. All right? So like I said, your stationary arm is lined up with the forearm, just like I said. All right? Mike, you heard me, right?
Where's the axis again?
Axis, the same thing. It's right at the CMC joint. All right? And you're just going to line straight across, and you're going to get the same exact measurement. There is nothing different. But does the addition thing make sense? You're starting from where you are to where you end, and that difference is your measurement. It's pretty clear, right? Okay. Now for abduction, abduction. You're starting right here. We'll go to opposition in a second. And coming out. So I'm starting, and this time you are just reading your goniometer as it is. So you guys are writing this stuff down, right? So when we're practicing, you understand this? So I'm going to bring her out. I'm going to take the entire hand. I'm going to bring her out into abduction. And I bring her right to about 75. We do not measure adduction here. Does that make sense? The last one is the one I skipped over, number 15, opposition. The goal here is just trying to take the fifth MCP and you're trying to touch the fifth digit. All right, so the person's hands like this, you're going to ask them to touch. This one to this positive or negative? What is he?
If you get to the other finger, then it's normal range of motion. Some resource texts will say if you can't, then you just measure the difference with like a tape measure, so like 1 centimeter off or whatever. But we're not going to torture you on practical. Just know that normal range of motion is touching the other finger.
Guys, I mean, for a quick clinical moment in the real world, if it was limited and you did measure it, you'd be able to show progress and have goals. That the patient was 3 centimeters away at the beginning, then after 2 weeks of therapy, they were 2, then 1, and then touching. Because you got to show a reason for what you're doing. Does that make sense? That's why you're learning this Goni right now? Right? Because patients are going to come in not normal like we are, and they're going to come in with limited motion. You have to be able to show that progress. Any questions with those? So flexion and extension, you take the difference. So if you start at 30, go to 45, it's 15. If you start at 30, go down to 10, you have 20. For abduction, you're just reading the measurement as is. Adduction, we don't measure. Opposition, do they or do they not touch? All right, and then you're looking at thumb MCP flexion. All right, so the flexion, I'll have a finger Goni again. Who has finger Goni?
It's right in front of you. Oh, no, not that.
That one?
Want to walk me one up, Florida?
I got it.
Thank you so much, Doctor. All right, so we're looking for thumb MCP flexion. Our normal is 90. Again, dorsal surface. Line everything up. Make sure you're in that plane. All right? And she is limited. All right? She has about 70. All right, what's normal?
921.
Thumb MCP extension. All right? Got her stabilized. Just bringing her right out. She's right at 0. And then you got IP flexion. All right? And we're going fast, guys, because this is all repetitive. It's the same thing over and over again. This is not that hard. All right? So IP. What's the difference with the thumb? Why is it IP?
There's only one.
Because there's only one. Okay. Same thing, dorsal surface, flexion. She has about 85, and then extension. Okay? Any questions? All right, Dr. Norman's going to take the floor.
All right. We're going to do MMT, and then I know it's fast, guys, but